Hello and welcome to today's session on drugs, sources and routes of administration. Today we are going to learn a lot about what all is the source and what are the routes of administration of various types of drugs. So let us begin. What all we are going to learn today and what are the objectives of today's session are: what is a drug and what are its features, and what are the various types of drugs and what are the examples of these drugs. Also, we will be learning about what are the various sources of drugs and what are the various different routes of drug administration, meaning how the drug enters into our body. We will also learn about what are the different types and what are the various examples of drugs. So let us begin. What is a drug? Drug is a term which is derived from a French word meaning drogue. Okay, here we have in India Ayurveda system, we have our own homeopathic system. Similarly, in allopathic system, mostly we follow words which are of German and French origin. So in French, the drug or drogue is a word which means a dry herb. A drug, also called is a medicine or a medication, is a chemical substance, and main purpose of the drug or medication or a medicine is to treat or cure a disease, prevent or diagnose a disease, and also to promote the well-being of a person. In pharmacology, which we are studying today, a drug is a chemical substance other than food which may be consumed, how orally, or inhaled, how through the nose and the mouth. It may be injected, it may be smoked, or it may be absorbed via a patch on the skin. It can also be dissolved under the tongue. This happens in some special circumstances, and I will explain what is this mode of transmission or entry of the drug into our body. Now, the drug, as I said, is a chemical substance other than the food which may be consumed, inhaled, injected, smoked, absorbed or dissolved under the tongue. Why? To cause a physiological change in the body. Why? Because the body needs to either repair itself or to fight against any pathogen or infection. Now, do you know which is the most widely used psychoactive drug in the world? It is caffeine, which is consumed by 90% of North Americans on a daily basis. We all know caffeine is found in nothing but coffee. Our dear old coffee contains a psychoactive drug, caffeine in it. That is why sometimes when we take coffee, we do not feel sleepy. We get sleepless. That is the property of this caffeine. And also you must have heard there are some varieties of coffee which are called decaf. Why? Because decaf means decaffeinated. The caffeine compound or the chemical, which is a psychoactive drug in the coffee, is taken away from the coffee. So in such coffee, which is a decaf, there is no caffeine and you can enjoy the coffee, the flavor, but you will not get sleepless nights. So the most widely used psychoactive drug in the world is caffeine, and this is cherished by all of us. So next, there are certain drugs which are obtained from medicinal plants. These are all natural drugs, but then there are certain drugs which are produced by organic synthesis. These are the synthetic drugs. They are manufactured and produced in the laboratories by use of various chemical substances. So, we have two kinds, one is the natural drug and the other synthetic drug. Now, let us see what are the various sources of drugs. The various sources of drugs or from where the drugs are obtained are plants, animals, humans. Yes, drugs are also obtained from humans. Microbes. Yes, drugs are also obtained from microbes. Mineral or earth materials which are found naturally occurring in various earths, rocks, mines. Also, drugs can be obtained from synthetic or chemical substances, as I said, and they can be manufactured in the laboratories. Drugs are also obtained by a technology which is known as recombinant DNA technology. Okay, so these are the various sources of drugs. Now, let us take one by one what is a plant originating drug and what are the various examples of these drugs. Plant originating drugs, as we know, are obtained from the various parts of the plants like leaves, roots, seeds and other parts of the plant. These may be dried and processed, and chemical substances may be either extracted from these plant parts or they may be used directly as such by either crushing them, making a pellet of them or boiling them. So, lot of drugs can be obtained from these plant sources. The active constituent from a plant are separated and sometimes concentrated to produce a more potent chemical or a drug. What are the examples? For example, alkaloids. These are the morphine, like for example morphine, bhang. These are obtained from poppy seeds. It is a psychoactive substance. Then quinine, as we all know. What is quinine? It is a chemical compound which is obtained from the bark of the neem tree, and we all know it is very useful in malaria. Patients suffering from malaria are given quinine which is obtained from neem tree bark. Then we have certain oils which are obtained from these plants like castor oil, olive oil, essential oils like eucalyptus oil, clove oil, peppermint, cardamom oils. These are all from plant origins. Eucalyptus oil, you know, is very beneficial and used in balms, and also it is in the concentrated form it is used to cure flu, cold and cough, sometimes headache also. Clove oil is very important in all dental treatments, it is used. So, clove, we all know that these are sometimes used on a daily basis even at home. So, mostly the drugs are since long they have been extracted from plants. Then we have certain resins and some types of gums and tannins also. You must have heard of a very popular and a common term called Triphala. Triphala, as we all know, is a combination of amla, harad and behed, which is all it is all dried herbs of plants, which is a very good immunity boosting combination. So, these are all the plant derived drugs. Next is the drugs which are obtained from animal sources. Let us see what are these animal sources drugs. Like for example, there are certain kinds of hormones which are obtained from pancreas of pigs, like insulin. Then we have certain kinds of vitamins like vitamin A and vitamin D, which is obtained from the liver of shark and other fish species, and we know the common name is cod liver oil. We have all had in our childhood cod liver oil capsules were there. They were nothing but obtained from the liver of fish. Then there are some enzymes like pepsin, which is obtained from the stomach of pig or cow, and certain kinds of anti-snake venom, like when we are sometimes, some people get bitten by a snake. So what is the antidote for that? It is anti-snake venom. And how is it obtained? It is obtained from the blood of horse. So these are the drugs which are obtained from animal sources, and the animals which have been used are pigs, liver of fish, even horse and cow. So we have some very important life-saving drugs which are obtained from animal sources. Next is the human source. Yes, we all humans also give out substances from which drugs can be manufactured. What are these human sources and what are the various kinds of drugs? Let us see. First of all is immunoglobulins. Immunoglobulins. What are these immunoglobulins? They are the drugs. Actually, they are the very important life-saving, we can say, drugs, which are obtained from the recovered patients or the humans who have recovered from a specific illness or an infection. Like, for example, we all are witnessing a pandemic situation these days of COVID. There are certain patients whose immunity was strong enough to fight the coronavirus and they got recovered from the corona on their own. Their bodies could fight this infection. So what has happened in their bodies? Their bodies, the blood in the body was able to produce antibodies against this virus. Now, when, say, such hundreds and thousands of patients who have recovered successfully from an infection, for example, as I said, a COVID infection, their blood, if extracted and pooled, and these specific antibodies are extracted, which is a specific antibody for fighting a particular infection, which is, say, for example, COVID. A pool of such antibodies of 100 or 1000 patients, when collected, is called immunoglobulins. So immunoglobulins, when extracted from the already suffering patients, they help, and when they are injected in those patients or those persons who are not able to fight this infection, they can then successfully fight with the virus. Their bodies can be injected with these immunoglobulins. So now you see how important are the immunoglobulins for the survival of those persons whose bodies are weak in immunity or whose bodies cannot fight this infection on its own. So we humans also serve as a source of drug or a source of medicine. This is one very important point which you all should remember, and also you should know what are immunoglobulins. Second is the growth hormones. Some growth hormones are excreted from the pituitary gland of humans, and they can be extracted and given to those who need these hormones. Then there are certain placental extracts which can be extracted from the placenta of a pregnant woman. So here all these drug sources are human beings, whether they are some glands, whether they are some successfully recovered patients of any severe infection or a pregnant woman, and also some gonadotropins which are obtained from the urine of a pregnant woman. So these are all the drugs or medicines which are obtained from human sources. Now next, let us see what are the drugs which are obtained from microorganisms. Some very important antibiotics like penicillin, streptomycin, erythromycin, tetracycline, They are all obtained from microorganisms. And also vitamins, for example, vitamin B12 is also obtained from microorganisms. These organisms are cultured in laboratories in large scales, and there's a procedure from where particularly these antibiotics are separated and collected from these microorganisms. The next source, as I said, was mineral or earth sources. You see, there are naturally occurring minerals, rocks, you've heard of iron ores, you've heard of gold minings, all these naturally occurring substances which are found on the earth. They serve as very important sources of medicines or drugs. So examples are like iron, ferric oxide, which are used in deficiency diseases like anemia. Certain mercurial salts, which are also used in diseases like syphilis. Zinc oxide is a naturally occurring mineral source which is used in the treatment of eczema and wounds. Gold salts, which are obtained from gold mines, are very important in treatment of rheumatoid arthritis. Then fluorine, borax and selenium, these are all antiseptics which are naturally occurring in mines and mineral earths. So we have studied a lot of sources. Now the second last source is synthetically manufactured drugs, which are manufactured with the help of chemicals in the laboratories. And lastly, the recombinant DNA technology, as I said, which is a technology which yields or manufactures medicines or drugs on a large scale. So both synthetic and recombinant DNA technology helps in manufacture of drugs on a large scale. In a recombinant DNA technology, what happens is that there is a desired band of DNA which is cut by an enzyme, and it is coupled by a replicating DNA of, say, a bacteria or a virus, which has a very fast rate of replication. So that desired band, which is able to fight a particular disease, is replicated many times with the help of a viral or a bacterial DNA. And this new genetic combination is inserted in bacterial cultures, and a huge amount of production is possible. So this is you can say a technology, culture technology, which is used for manufacture of drugs or medicines on a large scale. We complete the sources. Next we will go to various routes of drug administration. Let us see what are the various routes or how these drugs can enter into our bodies. So we have several routes. First is oral. Oral we all know, by swallowing by the mouth. Topical, parenteral, inhalation and rectal. So these are the 5 routes of drug administration. I will take them up one by one. First is oral. Oral is the most easiest and the most common form of taking the drug, and usually we all take it. We have taken it earlier also in form of tablets, capsules, syrups, okay. And in childhood sometimes we find it difficult, but still we are made to swallow these medicines with the help of water. So this is the most convenient and the safest and most economical route or way of taking a drug so that it can enter into our body. This oral route also has 2 categories. That is, once I said it can be swallowed with the help of water, and what happens is that it gets dissolved with the water as it enters and into our stomach, and where the gastric juices act on the stomach, and this is disintegrated and dissolved, and the body blood and body fluids easily take up this drug. Second type of oral is sublingual. Sublingual administration of drug is also a type of oral route in which the drug is actually placed under the tongue. This happens mainly in emergency cases where the swallowing of a drug is difficult, But a patient, for example, if he suffers a cardiac problem, a heart attack, then in that case you cannot force or you cannot ask, it is not possible also for a patient to swallow that drug. So what we do, there's a medicine very commonly we know, sorbitrate, which is put under the tongue, and once it is put under the tongue, it is called sublingual administration of the drug, from where the drug can be easily absorbed by mixing with the saliva of the mouth and taken into the it can be taken very fast into the blood circulation. So this is also one oral method of drug administration. Second route or the mode by which the drug can enter into our body is topical. Now what is topical? It is a form of application of drug on the skin. Now here what happens is that the drug or the dosage form is applied locally to the skin. For example, creams, ointments, lotions, pastes, or even powders. These drugs may have this antiseptic effect or analgesic effect, and even at times anesthetic effects. So this is also a very fast, not very fast, but it is a very effective route of drug administration, because our skin perspires, it gives out sweat, but it is also porous and it can also absorb the medicine from the top of the skin and take it directly into the blood circulation. So we all have in our childhood suffered from some injuries while playing. So what happens is on our any wound, the creams are applied, the powders are applied. These are all antiseptic form of drugs or medicines which are applied topically. Then topical application is also used on mucous membranes. What are these mucous membranes? Like nose, throat, eye. We have certain eye ointments which are called applicaps, which are in the form of a gel, which can be applied in the eye. We have certain kind of throat paints, like if you have some blisters or if there is a burn in the oral cavity somewhere in the mucous membrane of the mouth, or if there is a itching or pain or harsh or some soreness on the throat, so we apply the throat paints. So these are all topical type of drugs. Next we have parenteral route of drug administration. What is parenteral? Parenteral is nothing but injections. In pharmacology, inoculation, injection or vaccination form of drug administration is called parenteral route. It is given directly into the tissue fluid or into the blood without having to cross the intestinal mucosa. Now this route which we all are familiar with, which is called vaccination or injection, is a very fast and very effective route, because the moment a vaccine or a injection is given, it directly enters into the blood circulation. It doesn't have to pass through the stomach, and once given, it is not able to retrieve it back. So this is the most effective and the fastest, and also we can say sometimes the most dangerous form of drug administration or route of drug administration. This particular route, parenteral, has some advantages and disadvantages which we all should know. Firstly, I will tell you the advantages. They are that it, as I said, it is very fast acting. It has a very rapid and the fast action. Also, it is very effective for those persons or patients who are unconscious, who are not in a state that they can swallow a medicine, or who are uncooperative. Means some patients who are not ready to take the medicine, but they need immediate medication. They can be given an injection or a parenteral administration of a drug. Also, one more advantage is that there is no modification of the drug. What does that mean? that once we give the injection, the drug is as it is taken to the system. It doesn't have to pass through the stomach, it doesn't have to pass through the juices, gastric juices, doesn't break down in the liver. So there is no modification or the loss of drug in any form. The entire dose, whatever we give, is directly taken to the circulatory system. And also that the drugs which irritate the stomach, they can be directly absorbed in the blood by this parenteral route of administration. There are some disadvantages, and these are that it is less safe, but it is more expensive also, and you cannot administer the parenteral on your own. So we require a trained person to administer this kind of drug. It is little inconvenient since it is painful. You are injecting with the help of a needle which goes into your skin, so it is painful and inconvenient, and self medication is difficult or cannot be done. So there are also various ways in which a parenteral enters into our body. These are subcutaneous, intramuscular, intravenous. Now you please see these all names, they themselves will suggest you how these parenterals can be administered or given into your body. These are subcutaneous, means under the skin but not very deep. Intramuscular is inside the skeletal muscle. Then intravenous means that it is injected into the veins. Intraarterial also is sometimes used for the diagnostic purpose. Intraspinal means injected into the spinal space, and intracardiac means in certain emergencies it is injected directly into the heart cavity. So these are all the various types of parenteral administration drugs. Next we have the inhalation route. In this, certain kinds of volatile liquids or gases or aerosols are given which can be inhaled by the nose and the mouth. It may be a mixture of solid and liquid particles in the form of vapors. For example, the most common example as we know is the inhalers, Asthalin inhalers, which are given to asthmatic patients, and it is one more thing is that the drug is directly goes into your lungs. So it is a very effective way of drug administration. Lastly, we have the rectal route. Now rectal route is through the rectum, and we have jellies, creams, douches and certain tablets which are administered into the rectum. You must have heard of some term called enema, in which there is a soap water or a glycerin vegetable oil solution which is used to remove the fecal matter in case of very hard stool or a very hard constipated patient. So the rectal route is also another route of drug administration. So now let us sum up. We have studied about the various features of drugs, definition of drugs, and we have also studied in this session about the 7 sources of drugs like plants, animals, microbes, humans, minerals, synthetic substances and recombinant DNA technology. Also, we have studied about the various advantages and disadvantages of some important drugs like parenterals, whether they should be given on their own or there is some technical or technicians which are required for administering these kind of medicines. We have also studied about, or we have also heard about the various routes of drug administration like oral, topical, parenteral and inhalation, and lastly the rectal routes. And also we have studied about some examples and some diseases which are cured by the various drugs which are obtained from plants, animals, and also the various administration routes. So thank you very much, and I hope you have gained some information and knowledge through this session, and see you again. Bye bye.